Update in other news, Rhode Island is getting ready now to start administering more COVID-19 booster shots to vulnerable residents. The preparations coming as the FDA has approved third doses of Pfizer's COVID vaccine for certain groups. And reporter Kayla Fish is joining us live in studio to look at what the rollout is going to feel like here.
Well, Danielle, as we speak, a CDC advisory is reviewing data before issuing its own specific recommendations for booster shots. That decision could come by the end of today or the end of this week, and those spearheading the vaccination effort here in Rhode Island tell me the state could start giving third doses to tens of thousands of residents just days from now. The Department of Health's COVID Vaccine Subcommittee voting this morning to move forward with rolling out booster shots to certain Rhode Islanders as soon as the CDC issues its guidance for the third doses.
We want to get these out as quickly as possible. So if we have guidance this week, the goal would be to begin administering those vaccinations this weekend.
The CDC's recommendations are expected to align with the FDA, which yesterday approved Pfizer's booster for people ages 65 and up, younger adults with underlying health conditions, and people who work in high-risk environments like grocery stores, schools, prisons, or fire and EMS.
Department of Health and others have been working diligently, even before we had all of this information, putting a plan together.
Right now, the boosters would only be for people in these groups who got Pfizer, with the third doses administered 6 months after their second shot. About 130,000 Rhode Islanders would become eligible.
And then looking at all of those logistics that need to be in place in order to effectively get those booster doses out to people who they're indicated for.
Pharmacies are expected to administer the bulk of the booster shots, along with primary care physicians and local municipal clinics. The state is also planning targeted booster efforts in congregate care settings, correctional facilities, and communities of color, meeting people where they are.
Put those vaccines in people's paths, and that's what's allowed us to, fortunately be in a relatively good position for the Delta variant. But we're always preparing for what could potentially come next, and continuing to get as many people vaccinated as possible is critical.
Now, the committee also discussed the vaccine requirement for healthcare workers. As of September 13th, RIDO says about 87% of workers are vaccinated at facilities that reported data. State licensed facilities have until October 1st to comply with the vaccine mandate. Live in studio, I'm Kayla Fish, 12 News.